7 Deadly Diabetes Symptoms that Strike Without Warning. Imagine waking up one day feeling completely fine, only to realize your body has been silently shutting down for months. By the time you notice the symptoms, it might already be too late. Diabetes isn't just about high blood sugar, it's a ticking time bomb. Every year, over 100,000 people die from its complications, and the worst part? Many of them never saw it coming. Most people think they would recognize the warning signs, but diabetes can be deceptive. Symptoms creep in slowly, disguising themselves as everyday fatigue, minor discomforts, or stress, until suddenly, a heart attack strikes, an infection spreads uncontrollably, or an organ begins to fail. In this video, I'll reveal 7 deadly diabetes symptoms that can strike without warning, silent killers that can lead to coma, amputations, or even death if ignored. Number 1 is the most dangerous, and it's one that most people overlook. Stay with me until the end, because knowing these signs could save your life. Number 7. Diabetic ketoacidosis. Diabetic ketoacidosis, or DKA, is one of the deadliest complications of diabetes, and it can develop shockingly fast. When your body doesn't have enough insulin to process glucose, it starts breaking down fat for energy, producing toxic chemicals called ketones. As ketones build up in your bloodstream, they turn your blood acidic, poisoning your body from the inside out. If left untreated, DKA can lead to organ failure, coma, and even death within hours. One of the scariest aspects of DKA is how quickly it escalates. It often starts with excessive thirst, dry mouth, and frequent urination, symptoms that can easily be dismissed. But as ketones continue to rise, more severe warning signs appear: nausea, vomiting, extreme fatigue, and abdominal pain. Many people also develop a fruity-smelling breath, a red flag that acid levels in the blood are dangerously high. DKA is more common in type 1 diabetes, but can also occur in type 2, especially during illness, infections, or missed insulin doses. Stress, dehydration, and certain medications can also trigger an episode. Because symptoms worsen rapidly, checking blood sugar and ketone levels is critical, especially if you feel sick, weak, or confused. If you experience signs of DKA, seek emergency medical help immediately. This condition requires intravenous insulin and fluids to reverse the acid buildup and stabilize your body. Waiting too long can result in coma or death, so never ignore the early symptoms. If you have diabetes, make sure you always have a plan in place to prevent and respond to DKA before it's too late. Number 6. Heart attacks and stroke. Diabetes silently damages your heart and blood vessels, doubling your risk of a heart attack or stroke. Over time, high blood sugar thickens artery walls and triggers dangerous inflammation, restricting blood flow to vital organs. Worse, diabetes can damage the nerves that control pain, meaning many people never feel chest pain before a heart attack strikes. By the time they realize something is wrong, it may already be too late. Unlike the crushing chest pain most people expect, a diabetic heart attack often presents with subtle, easy-to-ignore symptoms. Sudden shortness of breath, dizziness, nausea, extreme fatigue, and even jaw or back pain can be red flags. Many diabetics dismiss these as stress or aging, unaware that their heart may be moments away from failure. Similarly, a stroke can start with mild confusion, blurred vision, or weakness in an arm or leg, only to escalate into permanent brain damage within minutes. High blood pressure, high cholesterol, and obesity, conditions commonly linked to diabetes, make these risks even more severe. If you have diabetes, you must monitor your blood pressure and cholesterol regularly and take immediate action if you notice unusual symptoms. Heart disease in diabetics is often called the silent killer for a reason, because most people don't recognize the warning signs until it's too late. If you suddenly feel unusual fatigue, breathlessness, dizziness, or unexplained discomfort in your chest, jaw, or left arm, do not wait. Call emergency services immediately. Fast treatment can prevent permanent damage or save your life. A silent heart attack doesn't mean it's harmless. It just means you won't get a second chance to recognize it. Number 5. Kidney failure. Your kidneys are responsible for filtering waste and excess fluids from your blood, but high blood sugar slowly destroys them without you even realizing it. Over time, uncontrolled diabetes damages the tiny blood vessels in the kidneys, reducing their ability to function. This process happens gradually, with no pain and no obvious symptoms, until kidney failure is already near. By the time many diabetics notice something is wrong, dialysis or a kidney transplant may be the only options left. One of the first signs of kidney disease is frequent nighttime urination, as the kidneys struggle to filter excess sugar and fluids. Swelling in the feet, face, or hands, constant fatigue, and nausea are also warning signs that your kidneys are under severe strain. As the damage worsens, toxins start building up in your body, leading to high blood pressure, severe itching, and even mental confusion. These symptoms can easily be mistaken for other health issues, delaying diagnosis even further. Shockingly, 1 in 3 adults with diabetes will develop kidney disease, and many won't realize it until it reaches the final stage, kidney failure. At this point, dialysis becomes necessary to survive, as the kidneys can no longer remove waste from the blood. Without treatment, toxins accumulate rapidly, leading to seizures, coma, and death. This is why regular kidney function tests are critical for diabetics, even if they feel fine. Get your kidneys tested regularly, maintain tight blood sugar control, and stay hydrated to reduce your risk. Kidney failure doesn't happen overnight, but by the time symptoms appear, it's often too late to reverse the damage. Number 4. Severe hypoglycemia. While most people worry about high blood sugar, low blood sugar, hypoglycemia, can be just as deadly, and it strikes fast. Hypoglycemia happens when blood sugar levels drop too low, starving the brain of the glucose it needs to function. Within minutes, this can lead to confusion, loss of consciousness, seizures, and even death. The most terrifying part? Many diabetics don't even feel it happening until it's too late. Early signs of hypoglycemia include shakiness, sweating, dizziness, and sudden anxiety, as the body desperately tries to correct the imbalance. But as levels continue to drop, the symptoms become more severe. Slurred speech, blurry vision, confusion, and weakness. If blood sugar isn't raised quickly, the brain can shut down completely, leading to coma or fatal heart arrhythmias. For diabetics who experience hypoglycemia unawareness, these warning signs may not appear at all. Skipping meals, taking too much insulin, or intense physical activity without eating enough can all trigger a dangerously rapid blood sugar drop. Older adults and long-term diabetics are at an even higher risk, as the body's ability to detect low blood sugar weakens over time. Without immediate action, hypoglycemia can turn fatal in a matter of minutes. This is why carrying fast-acting glucose, like juice or glucose tablets, is essential for anyone managing diabetes. If you or someone you know suddenly becomes disoriented, pale, or unresponsive, act immediately. Don't wait for symptoms to worsen. Administer glucose or glucagon if available, and seek emergency help if the person does not recover within minutes. A blood sugar crash can happen anytime, anywhere, and without fast treatment, it can be deadly. Number 3. Nerve damage. Diabetes doesn't just affect your blood sugar, it slowly destroys your nerves, leading to a condition called diabetic neuropathy. What starts as mild tingling or numbness in your feet can progress into severe pain, loss of sensation, and life-threatening infections. Many diabetics don't realize the danger until it's too late, and the result is often amputation. The biggest problem with nerve damage is that it hides serious injuries. Without feeling in your feet, you might not notice a small blister, cut, or infection. Over time, these wounds can become ulcers that refuse to heal, turning into gangrene, a condition where tissue dies. Once gangrene sets in, amputation becomes the only option to stop the infection from spreading. High blood sugar weakens circulation, making it harder for wounds to heal and infections to fight back. Even a minor injury can spiral into a deadly situation, and diabetics are 15 times more likely to need a foot or leg amputation than non-diabetics. Worse, once nerve damage starts, it cannot be reversed, only managed. That's why daily foot checks and early treatment are critical. If you have diabetes, never ignore foot pain, numbness, or sores that take too long to heal. Check your feet daily, wear proper footwear, and see a doctor at the first sign of infection. Diabetic nerve damage doesn't just cause discomfort, it can cost you your limbs and eventually your life. Number 2. Mental health breakdown. Diabetes doesn't just attack your body, it also takes a serious toll on your mind. The constant stress of managing blood sugar, taking medications, and dealing with health complications can lead to severe anxiety, depression, and even suicidal thoughts. Many people with diabetes experience diabetes distress, a state of emotional exhaustion that makes it harder to stay on top of their health. When this happens, neglecting treatment becomes deadly. Stress hormones like cortisol raise blood sugar levels, making diabetes even harder to control. At the same time, high blood sugar itself can cause mood swings, brain fog, and chronic fatigue, leaving people feeling hopeless and overwhelmed. Some diabetics stop checking their blood sugar, skip medications, or make poor dietary choices, not out of neglect, but because they feel mentally drained. This cycle of stress and poor health can quickly spiral into a medical crisis. Research shows that people with diabetes are twice as likely to suffer from depression, but many go undiagnosed. They may isolate themselves, feel persistently anxious, or struggle with sudden emotional outbursts. Worse, the financial burden of managing diabetes, doctor visits, medications, and testing supplies, can add another layer of stress, making proper care feel impossible. This can lead to life-threatening neglect of blood sugar management. If you feel overwhelmed, depressed, or constantly anxious, do not ignore it. Seek help from a healthcare provider or join a diabetes support group. Mental health is just as important as physical health, and failing to manage stress and depression can lead to dangerous complications, or even suicide. Diabetes is hard, but suffering in silence is even deadlier. Number 1. Deadly infections. Out of all the deadly complications of diabetes, we ranked deadly infections as the most dangerous because they are often ignored until it's too late. While heart attacks and low blood sugar can be fatal in minutes, these conditions usually have warning signs that trigger an immediate response. Infections, on the other hand, creep in silently, and by the time they become obvious, survival rates have already dropped significantly. A small cut, blister, or ulcer can rapidly turn into sepsis, a condition where bacteria enter the bloodstream and trigger a full-body shutdown. Sepsis kills up to 40% of those affected and can be fatal within hours. Unlike other complications, infections don't just affect one organ. They spread uncontrollably, causing multiple organ failure if not caught in time. Even the best medical treatment may not be enough if intervention is delayed. Another reason we consider deadly infections the number 1 most dangerous diabetes complication is because diabetics often don't feel pain in their feet due to nerve damage. Many people simply don't notice a wound or infection forming. By the time they see a doctor, gangrene may have set in, making amputation the only option. And if the infection has already entered the bloodstream, the person may die before antibiotics can take effect. This is why we place deadly infections at the top of our list, not because it is the most common, but because it is the most fatal while giving the least warning. If you have diabetes, never ignore an infection, no matter how small it seems. If a wound isn't healing, looks discolored, or has an unusual smell, get medical help immediately. Waiting too long could cost you your limb or your life. If you have diabetes, you cannot afford to ignore your body's signals. Are you constantly tired? Do your wounds take too long to heal? Have you been feeling dizzy, confused, or unusually weak? Even if the symptoms seem mild now, they can quickly escalate into life-threatening complications. Take action before it's too late. Which of these symptoms surprised you the most? Drop a comment below and let me know your experience. If you found this video helpful, hit the like button and share it with someone who needs to hear this. The more people who understand these risks, the more lives we can save.